Toronto's Board of Health reviews annual health progress. Bids farewell to Dr. Eileen de Villa. Welcome to Regent Park TV. At the November 18 Board of Health meeting, chaired by Toronto's City Councillor Chris Moise, important discussions unfolded, shaping the future of Toronto's health and wellness strategies. From appointing a new medical officer of health to advancing solutions for the city's drug toxicity crisis. The meeting addressed some of the most pressing challenges facing our communities. The first item on the agenda was the appointment of Toronto's next medical officer of health, as Dr. Eileen de Villa prepares to step down at the end of the year. The hiring committee and Phelps Group have finalized their search, with a recommendation for her successor now under review. Next, the board reviewed the 2024 progress report for our health, our city, a 5-year strategy tackling mental health, substance use, and harm reduction. The report highlights progress made this year, including the citywide expansion of the Toronto Community Crisis Service and new initiative to support affordable housing and 24/7 crisis services. One major focus remains the drug toxicity epidemic, which the board continues to address as a public health crisis. Key recommendations include urging the Ontario government to maintain supervised consumption sites, integrate them with homelessness and addiction recovery treatment hubs, and fund new substance use crisis centers for Toronto. The meeting also emphasized advancing an Indigenous wellness strategy, prioritizing harm reduction and mental health throughout Indigenous-led initiatives. Councillor Chris Moise acknowledged the steps taken and stressed the importance of continued collaboration to address the city's pressing health challenges. These discussions are especially relevant to the Regent Park community, highlighting the critical need for sustained harm reduction services and mental support to address local challenges and promote community well-being. Stay tuned for a closer look at the discussions and decisions shaping the future of health and wellness in Toronto.
Today is also our last Board of Health meeting with our amazing Dr. de Villa as our Medical Officer of Health. And I'm trying not to get emotional. I have been anticipating this day with a heavy heart since she has announced her retirement back in May. My relationship with Dr. de Villa started the same way as many of us here in Toronto, seeing her on my TV daily as she led us confidently through some of the most challenging times we have faced as a city. Little did I know that I would soon find a dear colleague and friend in that familiar face, Eileen. Since I stepped into the role of chair of the Board of Health, Eileen has met me with a willingness to work collaboratively and deep understanding of our residents' needs that keeps me certain that things will be okay even when challenges arise and circumstances are uncertain. She has proven time and time again that she is capable of navigating us through the most complex of situations with her leadership and knowledge. From the COVID-19 pandemic to its aftermath and ensuring regular TPH programming got back on track, to addressing the ongoing drug toxicity crisis and managing relationships across all levels of government. These accomplishments are just a few of the many Dr. de Villa has achieved during her nearly 8 years of service. While we will all miss you here at the city, your retirement could not be more well-deserved, and we wish you the best for all that is to come. Please join me in showing our appreciation for Dr. de Villa. And with that, I'm going to pass it over to Dr. de Villa to say a few words.
Oh, sure.
I brought a tissue box.
Thank you, Chair Moise, and good morning, everybody. You know, the recent US election has brought global attention to critical public health issues, raising concerns about potential policy shifts, the mainstreaming of misinformation, and uncertainty around future resources. These emerging challenges underscore the importance of strong health leadership and strong public health leadership, especially now as we navigate a landscape where misinformation increasingly blurs the line between facts and falsehoods. So on this, my last meeting here in front of you, I hope you'll indulge me for a brief moment as I just speak a little bit about public health and what it has meant to me and what my time here has meant as well. As I think about things, I know that public health must remain grounded in its core principles. Our commitment to connecting with communities, our commitment to communicating with empathy, listening actively, and making mission-driven decisions is more important now than ever. And at the heart of this mission lies our dedication to protecting and empowering communities, a guiding principle that remains our North Star. As we pursue this mission, public health aims to bring the best available science and data to the table. And I hope you appreciate that that's what we have tried to do here. That's what I've tried to do here these last 8 years. Again, not to advocate for any partisan position, but to serve as, a source of what is closest to truth that advances health and reduces inequities. I truly believe that public health efforts are strengthened when diverse perspectives are welcomed. As I know we have appreciated many times at this table and at tables all around this city, even difficult or opposing views can sharpen our understanding and improve our approaches, moving public debate forward in meaningful ways. It's also important to remember that behind every number or trend in our public health data are real people and real communities. This human aspect drives our commitment to equitable outcomes as we address complex health needs across our city. So as you will see on today's agenda, we do cover a number of key health topics in Toronto, including mental health and harm reduction through the Our Health, Our City annual progress report, and strategies to boost vaccination rates amongst school-age children and the youth in our city. As you heard from the chair, last year the Board of Health adopted Our Health, Our City, a 5-year citywide plan to address mental health, substance use, harm reduction, and treatment. And as I hope you'll hear shortly and see for yourself, we've made significant progress on our first-year priorities, and we're going to hear about those again today. We'll also today discuss Toronto Public Health's work to improve routine immunization rates amongst our youth. We know that high vaccination rates help prevent disease outbreaks. They protect against a number of diseases and certain cancers, and they do reduce infection spread amongst our families and in our communities. Over the course of my career, and I know for many of you around this table who've served the public for many years, we know that public health change rarely happens overnight. Educating and shifting public perception requires time, and it requires persistence, I would dare say, and strategic action as well. I recognize the profound responsibility we carry as public health professionals and as public health leaders. And today's agenda reflects our professional commitment to using the best available science, to fostering inclusivity, and to centering our work around the people and communities we serve. As this is my final Board of Health meeting as your Medical Officer of Health, I do want to take this opportunity to express my deep, deep gratitude to each of the members of this board. It has truly been the honor and privilege of a lifetime to work alongside such dedicated and passionate individuals, each of whom brings unique insights brings strong commitment and compassion to the vital work that is done in this building and throughout this city every single day. Together, we have faced some extraordinary challenges. I think you can agree. It has been a heck of an 8 years. We've made tough decisions, and we've worked together to protect and promote our community's health. I'm grateful for your trust, for your collaborative spirit, and for your shared commitment to improving health outcomes and reducing inequities across this city. Thank you to all of you for your commitment to this essential work and for allowing me to be a part of it. I will look forward to observing the positive impact this board will continue to have on the health, nice scarf, of all Torontonians. And of course, as mentioned by the chair, I would be remiss if I did not also acknowledge the upcoming departure of our colleague, Upala Chandrasekhara, who has served as the Director of Public Health and Strategy and Clinical Services at the end of the month. The chair has already described the amazing accomplishments achieved by this very remarkable professional in the last 2.5 years. It's hard to believe how much has been done in a relatively short period of time. So again, if I may, I just would ask you to briefly join me again in expressing our gratitude to Upala for her dedication to public service and wishing her all the very, very best as she takes on her new role with the Ontario College of Social Workers and Social Service Workers. Congratulations. So with that, Chair Moise, I will now turn the microphone back to you.
Thank you, Dr. de Villa. Just a reminder, we do have a reception for Dr. de Villa in Committee Room 3 after our meeting. So all the directors and staff here are more than welcome to join us. And I hope you do. So we'll now review the agenda. So item HL 18.1, appointment of medical officer of health. This item is going to be deferred in the next maybe week or two. We will canvass the board as to what times work for everybody. Yeah, we can do a motion now. Okay, I'll move this item. All those in favor? Opposed? Carried. Thank you. Item HL 18.2, Our Health, Our City. Also for item 18.1, I see there's 2 speakers on here. So you may choose to come back at the special meeting and depute if you like. Item HL 18.2, Our Health, Our City. Annual Progress Report 2024. We have presentations, so I will hold this item down. Item HL 18.3, Addressing Routine Immunization Rates Among School-Aged Children. Is a staff presentation, so I will also hold this item down. HL 18.4, Authority to Receive Grants in support of public health initiatives. Any speakers on this item? We have no one.
Number 3.
Number 4.
Yes, we have speakers.
There's speakers number 4? Yeah. Okay, we'll hold that item down. There's speakers. I'll check my list in front of me.
Here it is.
Okay. Item HL 18.5, Strengthening and Expanding the Into Kids Health Program. There are speakers on this item, so I will hold this item down. And HL 18.6, Proposed 2025 Schedule of Board of Health Meetings. There are no speakers on this item. Anyone like to move this item? Councillor Director Chandra Balin, all those in favor? Opposed? Carried. Thank you. Alrighty, so we will start off on item 18.2. You want to introduce the
Thank you.
speakers?
Chair Moise, we do have a presentation for this, and I will give my colleagues a brief moment to get to the presentation table. And perhaps as they get themselves settled in, I will start off making some opening remarks. As you heard in my opening remarks, we are bringing forward the first Our Health, Our City annual progress report for the board's consideration. As you mentioned, Mr. Chair, this is we've been 1 year since we actually launched this strategy. It was adopted by the board in November of 2023, and here we are with our first annual update. As our colleagues get settled there at the table, I do want to take this opportunity to thank the amazing teams that have been involved in the development of this strategy and in the progression of this strategy over the course of the last year. I also would like to take this opportunity to thank my colleagues at the Works. They do provide incredible client-facing, life-saving service every single day. They engage in heroic efforts that are certainly worthy of acknowledgement, not just today, but I would suggest for many days and weeks, months, and years to come. They are doing their best to respond to a very complex situation, the drug toxicity epidemic that exists here in the city and exists in many jurisdictions around the world. And again, it is an incredibly challenging task that they face and one that they do with professionalism and grace, and for that, I thank them. I also want to take a brief moment to thank the Mental Health and Substance Use Strategy team. They continue to amaze and do incredible work. And for that, I am incredibly grateful. And as well, how could I not thank our remarkable community partners? They keep us grounded, constantly work to provide the best available knowledge that they have as to what's happening to so many people here in our city, what's happening on the ground. Their collaboration and partnership is par excellence, and truly, we would not be able to do what we do without those amazing community partners. So, we're going to move into this presentation. You see at the presentation table, certainly some Toronto Public Health colleagues. Upala Chandrasekhara, who we've heard quite a bit about this morning, is there at the presentation table. She's going to walk through the presentation. She's also joined by our colleague, Katie Millen, our new Associate Director of Strategic Initiatives. You'll hear her talk about the progress that's been made thus far on the strategy. And we have some guest speakers joining us as well. I see my friend Colin Johnson, a member of Our Health, Our City Implementation Panel and co-chair of the Toronto Harm Reduction Alliance. He will be speaking about the importance of supervised consumption services and the anticipated impacts of upcoming provincial policy changes. And I believe as well we're joined by my colleague Denise Andrea Campbell, familiar to many, there she is. Familiar to many around this room, Executive Director of Social Development, Finance and Administration. She'll be providing us with an update on one of the priorities under the Our Health, Our City plan, the expansion of the Toronto Community Crisis Service. So with that, Upala, over to you.
Thank you so much, Dr. de Villa. Next slide, please. I'll begin today's presentation with an overview of the current context of mental health and substance use in Toronto. Next slide, please. Mental health is a critical component of overall health and well-being and has become an increasing concern in recent years. The percent of adults in Toronto who rated their mental health as very good or excellent decreased from 73.4% in 2015 down to 55% in 2021. In 2019, only 44.3% of Toronto youth grades 7 to 12 reported very good or excellent mental health, while 16.7% of Toronto youth reported seriously contemplating suicide in the past year. The percent of adults in Toronto who reported being very satisfied with their life in general decreased from 39.5% in 2015 to 29.8% in 2020. Many of us also experience our own personal challenges with mental health. It's important to acknowledge this and to recognize its widespread impact. Next slide, please. We also have data that shows there are significant harms from regulated substances, such as alcohol, tobacco, and cannabis in Toronto. In 2023, there were 19,653 emergency department visits and 6,981 hospitalizations attributed to alcohol in Toronto. In 2022, there were 3,050 emergency department visits and 1,234 hospitalizations for cannabis-related harms in Toronto. In an average year in Toronto, approximately 11,160 hospitalizations and 15,840 emergency department visits were attributed to smoking among people 35 years and older. Ongoing action for regulated substances is needed to prevent and reduce harmful health outcomes and additional pressures on the healthcare system. Next slide, please. And as we've been talking about for many, many months here at the Board of Health, Toronto continues to be in the midst of a drug toxicity epidemic. Beginning in 2016, the number of deaths due to opioid toxicity started to increase in Toronto. A further escalation was seen in 2020. In 2023, there were 4,514 non-fatal calls for suspected opioid overdoses attended by Toronto Paramedic Services. Based on preliminary data, there were 525 confirmed and probable opioid toxicity deaths among Toronto residents in 2023. The number of opioid toxicity deaths remained high, with over 500 deaths recorded per year for the last 4 years, and we have not seen these numbers return to pre-pandemic levels. These deaths are driven by a toxic, unregulated drug supply, which is now predominantly fentanyl. The unregulated drug supply has become increasingly unpredictable and contaminated with other substances. These contaminants complicate the overdose response and increase risk of overdose. These deaths can be prevented, which is why at Toronto Public Health, we continue to call for increased access to a full continuum of evidence-based healthcare supports, including prevention, harm reduction, and treatment services. Next slide, please. On Tuesday, August 2024, the Government of Ontario announced changes to supervised consumption and harm reduction services in Ontario. The province announced that they will be introducing legislation that will prohibit supervised consumption sites located within 200 meters of schools and licensed childcare centers. In Toronto, this will result in the closure of 5 supervised consumption sites by March 31st, 2025. Including the site that is currently operated by us at Toronto Public Health. The 5 sites anticipated to close due to the provincial policy changes include Parkdale Queen West Community Health Centre, their Queen's West site at 168 Bathurst Street, Regent Park Community Health Centre, their site at 465 Dundas Street East, South Riverdale Community Health Centre, their site at 955 Queen East, the Neighborhood Group Kensington Market site at 260 Augusta Street, and our Toronto Public Health site at 277 Victoria Street. We're also aware that a 6th site in Moss Park, operated by South Riverdale Community Health Centre, will likely close due to the expiry of a lease agreement and the subsequent prohibition on relocation of that site. The province also announced an opportunity to create new health service hubs called homelessness and addictions recovery treatment hubs, known as HEART hubs. The province is expected to invest $378 million for 19 HEART hubs across Ontario. Supervised consumption sites impacted by the provincially directed closures are being given the opportunity to transition to become these HEART hubs. The City of Toronto, Toronto Public Health, and our community partners have applied to operate a HEART hub. HEART hub applicants have been informed that we can expect to hear about the status of our applications before the end of the calendar year. While we greatly welcome these investments in the hubs, There is still critical need for more evidence-based services across the system, including prevention, harm reduction, and treatment. We need a range of evidence-based options to meet the diverse needs of people who are looking for support. However, these hubs are not a replacement for the services that will be lost with the closure of supervised consumption sites in Toronto. Next slide, please. The next few slides, we're going to share with you maps of suspected opioid overdose calls by neighborhood attended by Toronto Paramedic Services since 2019. And you will see that year over year, the highest number of calls for suspected opioid overdoses are consistently in the downtown area. So this is the map for 2019. You can see that the downtown core is lit up. Next slide, please. This is the map for 2020. So again, the downtown core is the highest area of need. Next slide. 2021, now you can start to see that other areas of the city are starting to light up. Jane and Wilson, Steeles and Bayview. But again, downtown continues to be the highest area of need. Next slide, please. This is 2022. Again, highest concentration in the downtown. And 2023 is the final slide with the maps. This is the last year for which we have full data. The stars pinned on this map represent the locations of the 6 supervised consumption sites that are expected to close by March 31st of next year. As you can see on the map, supervised consumption services are located in areas where there are high levels of need. Supervised consumption sites are clinical spaces for people to bring their own drugs to use in the presence of trained health professionals. Canadian and international evidence and our own experience in Toronto shows that supervised consumption sites save lives, they connect people to social services, and are pathways to treatment. There are currently 10 of these sites in Toronto. In 2023, across our 10 sites, we served a total of 94,872 client visits. In 2023, our staff across the 10 sites responded to 2,296 overdoses. I want you to think about that because that means over 2,000 calls that didn't get made to 911. In 2023, we collected a total of over 500,000 needles across 8 of our sites. And again, in 2023, we provided 9,867 referrals to health and social services across 9 of our sites. I want to thank each of our partners across the 10 sites, many of whom are here with us today. Thank you for your service to our community. We are grateful for all your work providing life-saving, medically necessary services for our community members. On April 1st, 2025, it's anticipated that Toronto will go from 10 supervised consumption sites down to just 4 sites located in the downtown core. Not only will the proposed restrictions and closures of these services increase harms and worsen the drug toxicity epidemic, it will also put additional pressures on the healthcare system, including first responders, paramedic services, and hospital emergency departments. Supervised consumption sites are life-saving healthcare clinical services. I want to take a moment to talk about Toronto Public Health supervised consumption site, The Works, which we have been operating since 2017. In 2023, we supported 18,575 client visits to our clinic. We responded to 464 overdoses and provided 3,750 referrals to other health and social services to our clients. I want to share with you an incredible experience of one of our clients. I will call her Sarah, which is not her real name. When Sarah came to us, she was pregnant and homeless, and she asked for our help to recover from injection drug use. We were able to enroll her in our injectable opioid agonist therapy program, IOT program, and she began with prescribed small doses of hydromorphone. We do not permit carries in our program. All prescription administration is observed by our nurses on site at our clinic. Over the weeks of Sarah's pregnancy, we were able to provide smaller and smaller doses, and she was able to wean off the medication. Our amazing team was able to help her find stable housing and connect her with primary care and obstetrics through our partnership with our partner, St. Michael's Hospital. By the time she was ready to deliver her baby, she was housed safely and her partner was housed too. She delivered a healthy baby, and now Sarah has regained custody of her other 2 children. And she and her family are doing really, really well. And our whole team is just so thrilled for her. I want to take a moment to thank our incredible staff team at The Works for their dedication and commitment to this important work. You are the heart and soul of our program, and you are frontline support to so many in need. Your actions are heroic. My sincere gratitude to our amazing clinical leadership team, Associate Director Sana Imran, and Associate Medical Officer of Health, Dr. Shavita Patty. Our managers, Samira Walji and Elpida Eritzos, and a team of incredible supervisors at The Works, Deb Tynan, Javance Bukumba, Nick Scrivo, Uma Budu, Patrick Livingston, and Steph Durack. Thank you for your leadership through our challenging circumstances. I want to thank our public health strategy team, Associate Directors Vanessa Fletcher, Dominic Popovich, and Katie Milan, and team members Kelly Crow, Suzanne Fish, Kirthana Lankaran, and Claire Harvey. This small but mighty strategy team is responsible for all of the behind-the-scenes work supporting our Health, Our City implementation panel and the interdivisional table and our community partners table. Special thanks to Mark Gaspar, Senior Policy and Strategic Issues Advisor. Mark held the pen on the Our Health, Our City strategy and helped us to complete the city's application to become a heart hub. Thank you so much, Mark. And many thanks to our communications colleagues, Acting Director Michael Blackburn and Michelle Simpson, Manager, and their incredible media team who provide so much support across our portfolio. I would also like to thank our epidemiology team, led by the amazing Dr. Nakashi Lamptey. It's Dr. Lamptey's team that consistently brings the current evidence to the forefront on the drug toxicity epidemic. Her team includes Associate Director Effie Gornis and team members Caroline Way, Soraya Blott, and Shashmita Rahman, who all work closely with our partners at Toronto Paramedic Services. And together, we keep the Toronto Overdose Information System updated every month with near real-time data. And finally, but most importantly, I want to thank you, Dr. de Villa. Thank you for your courage, your strength, and your leadership, and for pushing all of us to be better in our response to the drug toxicity epidemic. You are a hero. Thank you for everything that you have done to help save lives.
Mr. Chair, I think it is now over to me again. Thank you, Upala, for providing us the context and for your kind words and acknowledging the many people on the team who contribute to this very important work. If I can, I think we should continue on with the presentation. And if we can go to the next slide, we'll go through a bit of an overview of the progress made thus far in 2024 towards the implementation of Our Health, Our City, the strategy that has been developed. Next slide. As directed by the board, we have established an implementation panel to guide the actions over the 5-year course of this strategy. And if we can continue the acknowledgements and thanks, I would like to acknowledge and thank Deputy Mayor Malik for chairing this panel and for convening this important group of community stakeholders. Just by way of reminder to the board, the implementation panel does consist of 6 individuals with lived and living experience, 6 experts from mental health and or the substance use sectors, and 6 representatives from city divisions and other key city stakeholders, including such partners as the Toronto District School Board, Toronto Community Housing Corporation, and the Toronto Police Service. I should also note for the board that membership does include as well those from and working with priority communities facing mental health and substance use inequities, including people experiencing homelessness, seniors, African, Caribbean, and Black communities, women, youth, and 2S LGBTQ+ communities. The panel was first established this September and had its first meeting last month, October 2024. And this first meeting, in addition to organizing ourselves as a panel, we did focus on making sure that members were provided with an update in respect of what the mental health and substance use landscape looks like in the city at this time, and with an overview of implementation efforts on the strategy to date. The panel will continue to meet every 2 months, and their role, they will play a very key role in providing substantive input on priorities and direction for the strategy as it proceeds over the next few years. So with that, I'm very pleased to take this opportunity to introduce Colin Johnson, one of the members of the Our Health, Our City Implementation Panel, co-chair of the Toronto Harm Reduction Alliance, and friend to public health and community champion as well. So I'm going to hand it over to you, Colin, and thank you again for being here today.
Thank you so much, Mr. Chair, Dr. de Villa. My name is Colin Johnson, as you've heard, and I'm, as you have also heard, one of the co-directors of the Toronto Harm Reduction Alliance. I also want to identify as someone who's been living with HIV for 40 years and somebody who does drugs. I think the latter is quite important because, as you can see, I tick a number of boxes. I'm just going to start by saying that, all supervised consumption sites play a key role in collecting clients with health and social services, but they do far more than that. They also offer people their hood. This is where they come, this is where they live, this is where they interact with others, this is where they get updated on information, but it's also where they do their laundry, where they catch lunch and eat meals. This is so important, and I want everybody to understand that by closing these things, these people are not going to move. So let's understand that. What we're going to see overall when it comes to wraparound services, apart from being a safe place to use drugs, there's also the drug checking, housing, addiction services, safe supply, outreach workers, peer supports, which includes empowerment for people who use drugs so they can get jobs, the various other support groups that come with these institutions, testing for HIV, Hep C. In fact, at one of the CTS sites, South Riverdale, half of the users there tested positive for Hep C. They were placed on treatment. 84% of them are now cured. Harm reduction supplies, all of these things come with this place. And of course, wound care. What's going to happen when these places close? Well, sadly, all of that is going to go in many players. But more than that, you're going to see more public use of drugs on sanctioned OPS sites, in stairwells, subways, on the TTC. Everybody's going to say, instead of going to Timmy's for a coffee, let's go to Timmy's for some drugs. Reduced collection of drug paraphernalia. For example, South Riverdale collects needles 3 times a day. 3 times a day. That will go. But more importantly, we're also going to see people having to reuse their drugs and reuse their supplies. This is going to mean that there's going to be a spread of infections, viral and bacterial, Hep C, HIV, Hep B. HIV has a life of 42 days in a syringe. Hep C, 63 days in a syringe. I just want you to keep that in the back of your heads, everyone. Homemade pipes will explode. Brillo will slide down people's throats. It's because they can't get the proper screens. Abscesses, cellulitis, skin cancers, endocarditis, plus several 5-letter medical terms that I'm not going to touch for fear of mispronouncing. Increased risk in sexual activities. Increased ambulance calls. the unavailability of ambulance for other emergencies. This could be heart attacks, head injuries, accidents. I do not think we understand the vast scope of what the impact that this will have. There are shelters that we've been impacted by, 3 shelters we've impacted by these closures. So we'll find more substance use in the showers, toilets, people nodding off, which will lead to altercations. That will lead to more violence. And of course, I cannot begin to tell you how this will affect the staff of the places where people now go. More burnout, people leaving the jobs, exoduses. And then, of course, there's the impact to clients, to staff, when the clients die. I'm leaving that for last because I think everybody needs to understand how and the fact that people will die from this action. 47% of the people who use drugs presently access an OPS. They will lose access even if the other sites take on the extra work. 47%. 1,366 individuals each month use an OPS site. 37,144 people who use stimulants or opioids have had encounters in the healthcare system since 2023. Overdose mortality rate prior to the introduction of OPS sites was at 7.8 deaths per 100,000 people in the city of Toronto. With the introduction of OPS sites, it fell to 2.7 deaths. That is a remarkable decrease. Dr. de Villa has touched on the possibilities and how it will affect the marginalized communities. There's no words I can actually use to try to explain how much this will affect African, Caribbean, and Black, Indigenous, 2S LGBTIQ, women, youth, because they already have issues in addressing mental health assets or healthcare due to the stigma, the lack of funding, the lack of training. All this, well, and there's no other word to put it, will just get worse. When we look at the figures that the Ontario government put out, to call them lies would be minimizing it in so many ways. There has been no significant increase in violent crimes in the OPS sites. There's actually been a decrease in assault and robbery rates, and this is according to the Toronto Police Services reports themselves. When we begin to look and think about what this all means and how this will actually affect us, the only thing that comes to mind for me as somebody who's been living with HIV for 40 years is if the governments have decided not to allow the existence of AIDS service organizations or the hospices that dealt with the AIDS crisis way back in the 80s. That is the only thing that I think can come to mind. The actions of this government, of the Ford government, are unconscionable, to say the least. And going forward, one of the things that we know is going to count on the members of all the teams listed sitting here, City Council, the City of Toronto, the staff, working hand in hand with the other groups, ASOs, the marginalized communities and their representatives. But more importantly than that, and this is the key, you need to introduce and bring people who use drugs to the table. Regardless of what you might think, and I know many of us here are agreed, you don't know anything. You really don't when it comes to substance use. I hate to tell you this. Okay, so yeah, back in university, you smoked that thing I pot. Wonderful. Here, let's slap you on the back. But when it comes to the drugs that are presently available, you are as ignorant as a newborn babe. All of the things that have been created that you see and we're speaking about today came from drug user people. The government did not sit back one day and say, oh my God, let's go out and give away needles. No, sorry, that's not quite the way it happened, okay? It was drug user organizations like the one I represent, the Toronto Harm Reduction Alliance, that started to do this stuff illegally before everybody got on board. And of course, once you got on board, in many cases, you made a mess of it. But sitting back and looking back at the serious nature of what is going to happen, you really need us now. There is no doubt of that. And we're more than willing to work with you, of course, for pay. We're not cheap. Let's add that, okay? I would be remiss to advocate that we're gonna do this stuff for free. We did that already and you didn't listen to us, okay? So it's gonna take us working with the Toronto Police Service, and I'm gonna ask them to really look in going forward, not to arrest people who they see doing drugs in public. Where else do you want them to go? Putting them in jail is not gonna help the situation, okay? It's only gonna make it worse. The committee, our health, our city, we're talking about mental health, we're talking about substance use. They interact so closely. And it's really critical and important that I think that we all work together. But that also means that instead of some of the situations where I've seen where we have a board or a body that's above another, that has to change. I don't care what that body is. You need to have somebody or some representation from somebody who does drugs on that body, or else it will be a useless body. I'm gonna end up by finishing by saying, because I don't want to, I could go on for the rest of my days, seriously. I mean, you know, when I touch on the loss of friends that I have had because of this drug crisis, I'm tired. I've given up with tears. I cried enough during, AIDS, and, they brought me back to cry again. I don't have any more tears. I really don't. I think I'm gonna end with one of the quotes from our revered premier, where he says, in speaking about Ontario's growing opioid crisis, that doesn't work. I know. I have dealt with it in our family. I have dealt with it within our community. What works is rehab, detox beds, supporting these people with good paying jobs. Housing is absolutely critical, and there's a whole row of things, not just ignoring it. That's my personal opinion, and we're putting our money where our mouth is. Mr. Ford, in response, that is your opinion. My opinion is backed by fact. We know people are going to die if we continue down this road. We definitely know that things are not going to get better if you continue to implement these plans to close OPS sites. But lastly, sir, you're not putting your money where your mouth is. You're in fact removing money that could help save lives. Thank you.
So, Colin, thank you, as always, for your candor, for your collaboration, and for reminding the board of the importance of the work that lies ahead of all of us.
Thank you.
So with that, Mr. Chair, we still have a little more presentation. Board members, I beg your indulgence for a little bit more. If I can, I'll turn it over to Katie Millen, who will provide us a more substantive update on the progress in the last year on the strategy.
Thank you, Dr. de Villa, and thank you, Colin. So as we know, Our Health, Our City is a 5-year citywide strategy, which includes a number of recommended actions across 7 strategic goals. Part of our work in the first year was to develop a comprehensive picture of actions being taken across multiple city divisions that align with the goals of the strategy. So a full view of this work is included in the attachment of the report, but I'll just share a few specific examples with the board today. So Toronto, next slide, please. Toronto Paramedic Services have expanded the community paramedic-led clinic, where paramedics offer wellness clinics in subsidized housing buildings, naturally occurring retirement communities, as well as shelters. The Toronto Transit Commission, the TTC, has also improved access to naloxone to help prevent and respond to drug overdoses in the transit system. So effective January 17th of this year, fare inspectors are now carrying naloxone, and the administration of naloxone by TTC employees was expanded to operations supervisors. There are a number of initiatives between SDF&A, TSSS, and the TPS to partner with the Ministry of the Attorney General and the Ontario Court of Justice to implement 2 Justice Centre programs in Toronto, and a few other initiatives that are aligned with the 7 strategic goals that you see on the screen there. Next slide, please. As part of this report back, we also received direction from the Board of Health to review the existing and planned actions to reduce harm associated with cannabis, vaping, and smoking for youth through outreach and education initiatives for and with schools. So preventing and reducing the harms associated with substance use across the lifespan is one of our 7 priority goals in the strategy. And this, of course, includes taking action to reduce the harms associated with vaping, smoking, and cannabis use. So there are more details on this in the report, but TPH is mandated by the province to enforce the Smoke-Free Ontario Act, which regulates the sale, supply, display, and promotion of tobacco and vapor products at retail and prohibits the smoking of tobacco, cannabis, and vaping of any substance in enclosed workplaces and public places and at designated outdoor places in Ontario. So in addition to the health protection efforts that we have at TPH through inspections and enforcement, we are also responsible for providing health promotion and education services to reduce the harms associated with vaping and substance use. So again, there's more details in the report. However, the highlights include launching an online vaping hub on the TPH School Health webpage, which provides culturally responsive resources and programming on vaping prevention, reduction, and cessation, as well as providing significant education for students in grades 7 and 8, as well as over the last 12 months, Toronto Public Health has made over 14 recommendations in response to Health Canada's request for feedback on the Federal Tobacco and Vaping Products Act. So these are some of the examples of the actions planned and executed actions that we've taken in the last year. Next slide, please. So in April of 2023, the board has also recommended that we work with Indigenous service providers to co-develop an Indigenous mental health, substance use, and addiction strategy. In response to this recommendation, we have worked with Toronto Aboriginal Support Services Council to co-host a 2-day roundtable on Indigenous wellness. So there were several recommendations that emerged from this initiative, including a request for TPH to establish an Indigenous Wellness Committee that includes all Indigenous-led service providers in the city with the goal of co-developing an action plan to advance Indigenous wellness. We have begun this work, and we have held 6 meetings of this committee. And this committee is also being guided by an Indigenous facilitator. I would also just like to mention that parallel work related to Indigenous harm reduction is also underway. So in partnership with the Ontario Aboriginal HIV/AIDS Strategy, an Indigenous Harm Reduction Circle was officially formed in February of 2023. So this is Indigenous-led circle that is action-oriented, and its core mandate includes co-developing culturally appropriate solutions for Indigenous harm reduction and identifying strategies to address the health and wellness needs of Indigenous people who use substances. I'd like to just take a moment to thank the members of our Indigenous health team at Toronto Public Health, Monique Diabo, Josh Swain, and also Emma Tucker for their work advancing these initiatives. Next slide, please. Finally, I'll provide a very brief update on progress across the 4 priorities of year 1 in the strategy. So the priorities are up on the screen, and for advancing shelter services, supportive and affordable housing, there were significant advocacy efforts to both the provincial and federal governments, which led to Toronto's New Deal, which provides $600 million across 3 years in additional operating support for shelters and homelessness. The city has also seen advances on affordable and supportive housing, although we know that there is much more to be done in these areas. To establish a 24-hour crisis center, this is one of the priorities that is still ongoing. The Gerstein Crisis Center has also shared a proposal with Ontario Health for a 24/7 crisis stabilization center for people who use drugs. This is a very innovative model that would include 24/7 respite and stabilization, crisis intervention, short-term crisis beds, peer supports and follow-up services, including linkages to addiction medicine, treatment, mental health supports, and primary care. The report before you for consideration recommends that we reiterate the request to the Government of Ontario to fund this proposal. For police hospital transfers, I'm pleased to share that on September 14th, 2024, the Toronto Police Service launched a 1-year pilot project in collaboration with the University Health Network, Unity Health Toronto, and Humber River Health to expedite the transfer of care of patients to emergency room staff and reduce the wait times for frontline police officers. So this is a new program that operates 18 hours a day, 7 days a week, and we look forward to reviewing an evaluation of this effort next year. I will now hand it over to Andrea Campbell, the Executive Director of SDF&A, to provide an update on the expansion of the Toronto Community Crisis Service. Next slide, please.
Good morning, Chair Moise, councillors, directors, and Dr. de Villa. It's an honor to be here, and I know there's been a lot of conversation on this important topic. So we'll just take just a few more minutes to walk you through an update on the Community Crisis Service. Beside me is one of my colleagues, Nicole Watson, manager of the Policing Reform Unit that leads the work to develop and operate the Toronto Community Crisis Service. Before beginning this part of the presentation, I want to start by acknowledging the passing of Elder Wanda Whitebird. She was a traditional elder and strong advocate from one of our partners, Two-Spirited Peoples of the First Nations. Elder Whitebird provided traditional openings at both the launch of the Indigenous-led Toronto Community Crisis Service over the summer and at our citywide expansion event this past September. Elder Whitebird was a strong advocate for missing and murdered Indigenous women and girls and members of the 2S LGBTQ community. Elder Whitebird embraced the philosophy of harm reduction and was a fierce social justice advocate. If you wouldn't mind, could you just join me for a moment of silence in honor of Elder Whitebird? Thank you. Next slide, please. Thanks. The Toronto Community Crisis Service is one of the first priority actions of SafeTO, Toronto's comprehensive 10-year community safety and well-being plan. This work calls on the city to reimagine core elements of community safety and well-being in order to shift our paradigm from a reliance on reactive emergency response to a culture of proactive prevention. Expanding the Toronto Community Crisis Service citywide as Toronto's 4th emergency service is one of our first-year priority actions of Our City, Our Health, a mental health substance use, harm reduction, and treatment strategy for Toronto. As you know, the strategy focuses on promoting health and well-being across the lifespan, and it is our honor for this service to be one of the key priorities. Next slide, please. As a reminder, the Toronto Community Crisis Service was developed after the tragic deaths of Regis Korchinski-Paquette, Chantel Moore, George Floyd, and many others in the spring of 2020. And the resulting calls to reform police, accompanied by a global movement calling for critical reforms. Following these calls, City Council adopted a set of 36 recommendations in June 2020 intended to reform policing in Toronto. These reforms touch on several areas, including policing, public safety, and crisis response. My division, Social Development, Finance, and Administration, was charged with driving policing reform and building an alternative response for persons in crisis without police involvement. We undertook a jurisdictional research and extensive community engagement process to develop a community-based, made in Toronto community crisis service. And that is how the Toronto Community Crisis Service was born. And we begun the service in pilot areas at the end of March 2022. Last year, in November 2023, City Council approved the citywide expansion of the service by the end of this year. And I'm proud to say that we soft launched this citywide expansion on July 8th, 6 months ahead of schedule. Next slide, please. The current map of citywide service after, this is the current map of citywide service after piloting in 60% of the city for 15 months. You'll see here our incredible partners in the North Etobicoke and North York. CMHA Toronto branch leads the mobile teams. In Central Toronto and South Etobicoke, Gerstein Crisis Center. Taibu Community Health Center leads the mobile teams in all of Scarborough. And Two-Spirited Peoples of the First Nation leads Indigenous-specific citywide service. Next slide, please. When we were building our model for the crisis service, the importance of building community trust was affirmed over and over. This guided our hand in developing a Toronto Community Crisis Service as a collaborative model where the city serves as backbone for the service and 4 strong, trusted community partners serve as anchors who deploy the mobile crisis teams across communities. One of the special features of the Toronto Community Crisis Service is that each anchor partner brings with them an extensive network of partners that serve as referral pathways to additional services and supports. The slide outlines some of those key partners. This is not an extensive list, however. You can still see a number of community health centers and culturally specific supports noted here, such as the Rexdale Community Health Center, Hong Fook Mental Health Association, the Regent Park Community Health Center, the Weaving Wellness Center, and Thunder Women's Healing Lodge. Next slide, please.
Thank you very much, Denise. I'm going to jump in here to discuss a little bit about what is the TCCS. So as mentioned, this was developed with intensive community input, and what we heard strongly from community was the service itself needed to be available 24/7. It needed to take a no wrong door approach that leveraged multiple intake channels. Our main intake partner is Find Help 211, but we also are the service is also accessible through 911. The service itself is voluntary and consent-based and serves Torontonians 16+ with a trauma-informed and harm reduction approach. Mobile crisis teams are deployed and able to meet individuals where they are at to offer on-scene crisis support, but also follow-up crisis case management and service navigation. And we do have a focus on culturally relevant services and referral networks, especially for those who identify as Indigenous, Black, and the 2S LGBTQ+ community. If I could have the next slide, please. This is to show a high-level service map in terms of how one might access the Toronto Community Crisis Service. So a call comes in either through 911 or directly to 211. 211 call takers then assess the call. Assuming it's eligible for TCCS, the teams are dispatched and the mobile teams are able to arrive on scene. Currently, our arrival time is within about 25 minutes. They then offer on-scene supports and help to de-escalate a crisis situation that may be occurring. The teams then offer follow-up support within 48 hours and ongoing crisis case management support for up to 90 days. I'll pass it back over to you now, Denise.
Thank you. Next slide, please. So from the outset of creating this new service, we engaged a third-party evaluator, CAMH's Provincial System Support Program, and Shakme Makwa, to work with us to monitor and evaluate the results of the service. Transparency is a guiding principle in our operation of the service, so we publish our evaluation reports. Our 6-month and 1-year evaluations are on the city's website for the service. Before you are our service outcomes since the start of the service in March 2022 until the end of this summer. The crisis service has now responded to almost 16,000 calls since its launch. By comparison, at this time last year when Council approved the citywide expansion, this crisis service has had only responded to 16,000 calls. So that's an increase in 10,000 in the year. 211 is now the dominant window into the service for Torontonians, with 58% of calls coming in through 211 and our community partners. Our public education is working. As a result of the crisis service, Toronto Police Service has experienced a 4.5% reduction in person in crisis calls in 2023, so we were not yet citywide, as compared to previous years before the service was created. Now that the Toronto Community Crisis Service is citywide, we expect continued decreases in person crisis calls attended by police service. Although I have to acknowledge that this point was noted before the real harms and challenges that Colin and others have been speaking about this morning. So we expect continued demand on this service. Next slide, please. Almost 6,000 referrals have been made on-site and during follow-up visits, and 1,200 service users have been connected to case management following the emergency response. I need to reiterate, an important part of this service isn't just about responding to people in their most vulnerable moment with the right response. It is about trying to reduce person in crisis calls over time. The provision of culturally relevant supports is an important aspect of the service. Between October 1st, 2022 and July 31st of this year, 471 culturally relevant supports were provided to our service users. 47% of those supports are Indigenous specific, and 16% are Afrocentric and West Indian Caribbean centric supports. And the next and final slide, please. So our evaluation to date is showing that the Toronto Community Crisis Service is positively impacting the lives of Torontonians in the ways that communities, activists, and academics have called for. 95% of service users have said they were satisfied or very satisfied with the service they received. 90% said the crisis service has increased their feeling of safety and well-being, and 95% said they were connected to the supports that they wanted. So let me close using their words. One user said, "They helped me understand that I am worthy and that they wanted to see me go forward. They uplifted me and made me feel like I am worthy." Another shared, "It is just such a feeling of comfort, and with that, the element of safety is present, knowing that the services is there and it is safe." And finally, another service user shared, "The Toronto Community Crisis Service talked to me, and they talked to my son, and they talked to all of us. And I'm still used to people saying, we're gonna do X, Y, and Z, and then nothing really happens. But oh my gosh, they went above and beyond." In closing, I want to thank the incredible team in social development and our partners that bring such wisdom, expertise, compassion, and commitment to creating this effective community care model. Thank you for the opportunity to share our progress.
So if I may, I will echo your note of thanks, Denise, and extend one to you and Nicole for being here today, for sharing this presentation with us, and for your collaboration and partnership as always. Mr. Chair, I realize this has been a long presentation. I will just thank all the presenters that have come here today, and again, our collaborators and partners all around the city, some of whom are not here today. This is an incredible body of work, as I hope you see. There is much ahead of us. It is not something we can do alone, but I hope that the board is heartened by the many partnerships that we have out there, the professionalism of the team that is working on these important and complex issues. And, you know, I look forward to hearing about the progress that continues, you know, from here on in. So thank you, Mr. Chair.
Thank you, Dr. Villa. I've been chair for 2 years of this board, and I've never received such a well-informed progress report. It was heartfelt. And I'm happy that you took the time to actually go through it as you did. So, and I also appreciate how many thank yous there were. You can never say thank you often enough. So thank you to all of you for all that you do each and every day, especially those on the front lines. We do have speakers on this item. Jeffrey Dale, are you here? Good morning. Okay, you have 5 minutes.
Thank you for allowing me to speak today, and good morning, Chair Moise, members of council, city staff, and members of the public. I'm Reverend Jeffrey Dale, and I'm the minister at College Street United Church at the corner of College and Bathurst. I live near the church, and as such, my home and church are situated between two safe consumption sites, consumption and treatment services, Parkdale Queen West and Kensington Market, both slated to close. Since the province's announcement in August 2024, College Street United Church's electric sign has proclaimed that harm reduction is spiritual. Save SCS. As a community of faith, we are training ourselves in naloxone use and have naloxone kits in every bathroom and office in our building. I come to you today as a minister, but also as a former user of illicit substances, to appeal for your support to uphold the potentiality of your Our Health, Our City substance use strategy. Just over 10 years ago, I was addicted to OxyContin. In many ways, I was fortunate. I bought my pills on the street, and at those pills were real OxyContin. I lived in a relative comfort. That is not the same for others today. Since then, I have watched this country, province, and city's realities relating to substance use change and evolve, and not for the better. Each of us in this room know the realities and statistics of how harm reduction saves lives. We know that safe consumption sites and services save lives, and yet here we are, again, asking that our friends, our neighbors, and our community be afforded the opportunity to live. We at College Street are extremely fortunate to host the winter meetings of the Harm Reduction Advocacy Collective. This advocacy collective comes together to proclaim one another's worth and dignity, protect one another's agency for an opportunity for life. Since coming to College Street in May, I've experienced people in need, and most often these people engage in substance use. It exhausts me that our fights in the past, which brought us further to building a community of care, are unraveling right before our very eyes. It aggravates me that we must continue to protest and call upon our levels of the government to assist us in seeking ways to reduce harm. Most of all, though, as a citizen of the city which I so dearly love, I am grieving that the most marginalized citizens are being pushed further into the corners and the shadows. Our neighbors are crying out in pain. And so often I wonder, will we ever hear their laments in the din of a city progressing along? We need you more than we ever have before, to join us beyond the walls of City Hall and out into the trenches of this war that has been waged against people who need harm reduction. The province's decrees, once again, have called many of us to action, and in doing so, it brings up our pain and our fear. And so I implore you to ensure that harm reduction and consumption and treatment services are not wiped away with the provincial announcement and pending legislation in our neighborhood and throughout this city. This is truly our opportunity to envision a Toronto the good that is good for all her citizens, especially those who will and are dying in the shadow of the CN Tower, hoping against hope that someone, anyone, is listening. At the end of every harm reduction advocacy collective meeting, we join together in a circle and vocalize the names of those we've lost due to toxic drugs. Every time, names flood out. And I recognize just how large our circle would be if we were all afforded the same dignity and privilege others are gifted with by those in power. Our leaders will then say, "We mourn the dead and we fight like hell for the living." Now is the time for us all to fight. I can only hope that you will all be with us on the front lines once more. Thank you for your time.
Thank you, Jeffrey. Any questions for the deputant? Seeing none, thank you for coming in today. Kevin Wilson? Kevin Wilson, are you here? Okay, you have 5 minutes.
Thank you. Good morning, and thank you for the opportunity, Chairman Moise, and members of the board, and councillors, and members of the public. My name is Kevin Wilson, and for just over a year, I have been a client of Parkdale Queen West Community Health Centre. My first visit was to the supervised consumption site at 169 Bathurst. I would like to share with you how my life has transformed since that visit. When I was first buzzed through those doors that day, I was homeless. I was struggling under the weight of multiple traumatic experiences. I was dealing with a number of secondary issues that frequently are companions of IV drug usage. I felt very alone, isolated, and trapped inside a deep pit of depression and isolation. Today, I am no longer homeless. My housing situation is far from ideal, but I am not looking at the prospect of spending Christmas on the street. That was what I faced last year. I'm receiving treatment and counseling for my secondary conditions I've had to deal with. Most importantly, I no longer feel alone and trapped in a deep pit of despair. That was my reality last year. I have not climbed out of that pit yet, but I feel like I have a toehold. All of these things have occurred because I was buzzed through those doors at 169 Bathurst last year. To the staff I encountered there, I was more than just an addict, a homeless person, mentally ill. The staff saw me as fully human and treated me accordingly. When I was hungry, they provided food. When I was thirsty, water and juice. When I was sick, they provided medical care. Most important of all, when I despaired, they provided a sympathetic ear, a supportive word of encouragement, a shoulder to cry upon, and a hug. And amid all of this, the knowledge that I was not alone. There were people who cared for me and had my back. They believed in me and wouldn't give up on me, even in those moments where I had given up on myself. Thanks to those workers, I was assigned to a case manager who became my greatest advocate. My case manager helped me in countless ways. Thanks to them, the ID I had lost was replaced. I moved first from homelessness to respite care, into the shelter system, and now into supportive housing. Thanks to my case manager, I have hope for the future for the first time in years. None of this would have happened had I not visited that supervised consumption site just over a year ago. I cannot emphasize to you strongly enough the profound negative impact shuttering 5 supervised consumption sites in Toronto will have. People will die if this ill-considered plan proceeds. The province's rationale for taking these steps has no grounding in objective fact. Rather, it smacks of an electioneering strategy which seeks to turn people like me into convenient straw men ahead of a writ period. Playing fast and loose with the lives of vulnerable people who have virtually no resources to fight back can only be described as shameful, disgusting, and unconscionable. I cannot and will not in good conscience remain silent while any level of government seeks to dismantle the modest improvements to our well-being that have been made in the past few years. I will fight this with every fiber of my being, and I urge the board to make every possible effort to prevent the province's plan from going through. Thank you.
Fiona Ezekels? How do you pronounce your name properly?
Ezekiel's.
Ezekiels, thank you. You have 5 minutes.
Good morning. Thank you for allowing me to speak today. My name is Fiona Ezekiels. I'm a member of the Harm Reduction Advocacy Collective. I'm a Master of Social Work student at York University, and I am an overdose prevention support worker at a supervised consumption site that is set to close on March 31st, 2025. I'm here today to express my support for the recommendations outlined in the Our Health Annual Progress Report. I come to you not just as a frontline worker, but as someone who carries the weight of this crisis in a very personal way. For over 2 years, I have worked at a supervised consumption site, and in that time I have witnessed the devastating toll of the toxic drug supply crisis. Sorry. This crisis is compounded by an inadequate public health response, which has failed to meet the needs of the people who use drugs. The people I have cared about, thank you, friends, clients, and community members have died. Responding to and reversing overdoses, while critical, is the easiest part of my job. The hardest part is the vicarious and secondary trauma of witnessing people fall through the cracks of a broken system, being displaced, relocated, redirected, and repeatedly let down by the very system that is meant to support them. For example, having to relay to a service user that central intake once again does not have a shelter bed available, that there are no detox beds, that wait lists are months long, and that there are no other options available. This is the unfortunate reality for many precariously and unhoused people who use drugs who are seeking help. I am terrified of the repercussions of the potential closure of 5 supervised consumption sites in Toronto. This decision by the provincial government is nothing short of social murder. If these closures happen, people will die. Instead of needles and paraphernalia, people will find bodies, lifeless reminders of our collective failure. Paramedics, police officers, librarians, gas station attendants, shelter workers, social workers, community members, friends, families, and parents will all be at risk of experiencing the trauma of preventable loss. I am haunted by the memories of people who have died due to the toxic drug supply crisis. Each person was a life full of hope, dreams, love, care, generosity, and each person deserved to be here today. I will replay the last moments that I saw them and wonder what I could have done differently. But I have come to realize that this is not an individual failure. It is not about what I or my coworkers could have done differently in any one moment. It is about a failing system, a system that doesn't provide enough support and leaves people vulnerable to preventable harm. Internalizing that failure will not help anyone. What will help is action, investing in proven life-saving interventions like supervised consumption sites, harm reduction services, and safe supply. Every day that we delay or underfund these services, we risk more lives. For every person lost, there are ripple effects, grieving families, shattered communities, and frontline workers like me who bear the emotional scars of losing yet another person who deserved to live. I know that you all understand this, and I am begging you to continue to recognize the drug toxicity epidemic as a public health crisis. Commit to actions that are evidence-based. Reiterate the request to the Government of Ontario to protect community health, well-being, and safety, to continuing to fund and permit the operation of all currently operating supervised consumption services, consumption and treatment services sites beyond March 31st, 2025. Permit the co-location of heart hubs, supervised consumption services, and consumption and treatment services sites to provide life-saving medical services, primary care, and increase pathways to treatment services. And to reiterate City Council's request to the Government of Ontario to consider the inclusion of supervised consumption services in their new HEART program proposals. I am begging each and every one of you to please do this. Thank you.
Thank you, Fiona. Any questions for the deputant? Seeing none. Thank you for coming in today. Callum Houston, Harm Reduction Advocacy Collective.
It won't take long. I'm an organizer with Harm Reduction Advocacy Collective, and we're just here to urge the city, the public health, to support safe consumption sites and these other services and programs that help people who use drugs and people struggling with addictions. There's a need for, I really do respect the work that's being done right now and by the people here. I know that you guys get a lot of flack for from the public for not doing, from their perspective, enough, but it's a very complicated, and I respect how complicated this is and how many compromises you have to make even. But as Dr. de Villa has said, and I'm glad that she says this, that public health is about following the facts and the data, not ideology. And this province is only operating on ideology. There's not a shred of evidence that supports what they're saying. And I know all of you know this, but you need to be saying this to the public. They need to hear you saying this. This is not just one conference after, or every 6 months when people have forgotten about it. We need people out with nurses talking, spreading awareness, telling people that, you know, what is happening is not right and is not science-based. And that this report, I understand, is meant to tackle this issue, but there needs to be more done. You know, Colin said a lot of great pieces there on what could be done, as well as a few other speakers. I really do urge you to listen to what they have to say, especially including people who use drugs, including them in the conversation, in the decision-making process, on part of committees, because, I mean, we can go back 10, 20, 30 years, whatever committees there are that are for any civil group, for any marginalized group, you always include them in the conversation. You don't make decisions that affect them and exclude them. So I just urge you all to really listen to what has been said and what will be said by a few more speakers, and that we want to, you know, everyone wants I think the same thing. Thank you. So that's everything. Thanks.
Thank you, Callum. 5 minutes.
Good morning, everyone. Thank you for having me speak. My name is Joseph. I'm here to talk to you about safe consumption sites and harm reduction services. I've been involved in harm reduction for over 10 years. It's been 8 since I buried my wife due to an overdose while I was at work. If these sites were more available when my wife overdosed, she might still be here with me today. There isn't a day that I don't think about her or even cry about her. They took the love of my life away from me, and I would never see her again. We need these sites to stay open, because if they close them, it would definitely lead to more deaths. Alleyways will be flooded with people who use drugs. A lot of my friends and colleagues use these services, and I have already lost a lot of my peers to overdoses. So when these sites close, I'm going to lose a lot more. My brother was there for me when my wife passed, and I was there for him when his wife died to an overdose as well. When I found out about his wife passing, I posted on Facebook for him to get a hold of me, because I wanted to be there for him. The government needs to know that we take care of each other. I also know that if and when these sites close, along with Safe Supply program, will affect a lot of people who have become dependent on it. Therefore, I hope that Doug Ford and the Board of Health has something put in place for those who rely on Safe Supply as part of their recovery. These services are so important to our treatment. So as I stand here today, I strongly urge the Board of Health to push Doug Ford and the Conservative government to overturn the decision to close all safe consumption sites and harm reduction services because they save lives every day. Since the toxic crisis started, there has been 0 deaths in all provinces sites. I mean 0 deaths. Not one has ever occurred. This is a dangerous decision. We know that there has been over 441,722 non-fatal overdoses reversed in these sites across the province. So with that said, first 2 of these sites closing, there will probably be hundreds of fatal overdoses. So don't close our sites and remove our harm reduction services. They save lives. These heart hubs that you call heart hubs, they will not help to the degree we need them to. They won't provide the support that people need to stay alive. Thank you.
Thank you, Joseph. Any questions for the deputant? Seeing none, thank you for coming in today and sharing with us. Justin Niera Ariza, Harm Reduction Advocacy Collective. I think you're online. No? Okay, in the room? She's here. You have 5 minutes, go ahead.
Thank you to the Toronto Board of Health for allowing me to speak today. My name is Justine Nedarisa. I am a healthcare provider, community member, and constituent of the city in Ward 9. I'm here to speak to in support of the Board of Health's recommendation to protect community health, well-being, and safety by continuing to fund and permit the operation of all currently operating safe consumption sites and community treatment services sites beyond March 31st, 2025. I am also here to emphasize that it is imperative that the Board of Health acknowledges the responsibility and continues to fight for and oppose the provincial decision. I insist you, Board of Health, to advocate and fund the full spectrum of harm reduction services across the City of Toronto. As a healthcare provider throughout the GTA, I understand and acknowledge how many live safe consumption sites have saved, how access to harm reduction supplies have prevented chronic health conditions, and I have been a witness to the positive changes for people receiving a safer supply. I am also here to paint you a picture of what being on the front line of this work looks like. I work within a team that provides outreach and primary care support to unsheltered Torontonians. As the team's case manager, I support community members with housing applications that are years long, system navigation, accompaniment to appointments, and hospital visits. I ensure they stay connected to registered nurses and a family physician for medical treatment and interventions. I refer them to additional services that are imperative to their health, to access support for their substance use on all spectrums, from access to harm reduction supplies, safe consumption sites, to detox, in and out patient treatment, to achieve whatever goals they desire in their recovery journey, all while they try to simply survive. Our team is often called to emergency departments, general medicine wings, and ICUs to meet with clients in hopes to continue care when they get turned back to the streets. Most of our clients get discharged from the hospitals back to the streets, at times medically okay and stable on paper, but left to keep wounds and continue follow-up care in places that are not fit for such thing, such as tents, alleyways, bus shelters, trains. Healing without a home is almost impossible. The announced heart hubs are actually no different than many of the services that are already available. They simply just can't replace life-saving services. That's the only difference. As a team, we work collaboratively with the lowest barrier of support, including safe consumption sites, drop-ins, and churches. They're a vital part of life-saving care. They have opened their doors to a community that has been left behind by many services. They provide a break from being outdoors, a space free of judgment, a space where folks can feel safe and comfortable, a place many call home, a place many turn to when there has been nowhere else left to turn. Safe consumption sites and drop-ins often call us and say, hey, this person is looking for you. And we go to meet them, or we chat over the phone. They're not only vital to keeping them alive, but imperative in ensuring that they stay connected to those that they trust and want as a part of the continuum of their care. Closing safe consumption sites and banning the application pathway to any future sites is a death sentence. The scale back of harm reduction services, including distribution of new and sterile kits and needle exchange programs, will result in an increase of chronic bloodborne infections for an already vulnerable community. Closing the door to safer supply programs mean that many will not have access to evidence-based treatment in a nationwide toxic drug supply crisis. People who use drugs are being used as scapegoats while all levels of government abandon our communities. The provincial government has made a false dichotomy between treatment and harm reduction when no such difference actually exists. The claims and plan of the Conservative province agenda are all about community safety, but there is no safety when we know the many critical implications this decision will bring. Do not use community safety in our name. More than ever, we need justice and compassion and care, not shame or a scale back in spectrum of services. We need scaled up funding, we need housing, we need safe consumption sites, we need harm reduction, we need safer supply, we need accessible voluntary treatment, we need drug policy changes. We cannot care for dead people. Every accidental overdose is social murder. Every life lost is the life of a child, of a parent, of a friend. We urge you, expand these sites, expand harm reduction programs, abolish public treatment wait lists. They don't call it frontline work for anything. We will not stop fighting for community-based care. We take care of each other in ways none of you will ever understand because all levels of government have failed us. COVID-19 showed us that change at times of emergency can be done swiftly. We have been in an emergency for years, and it's time to act like it. Too many lives have been lost, people are burning out, and we are all traumatized. Thank you for your time.
We will take it in-house now to board members. Deputy Mayor Malik, go ahead.
Thank you very much. First of all, just want to thank everyone who's come and spoken to us today in response to this progress report and also in response to what we're seeing from the provincial announcements and the outcomes that are being anticipated. And my first question is about that, and I'd like to hear a little bit more about how the changes being brought forward by the provincial government are affecting both our work, residents' health and well-being, and the implications for the Our Health, Our City strategy, given that when this was finalized and landed, we had not anticipated some of these significant changes to service delivery and access in the City of Toronto.
So through the chair, thank you for the question. Clearly, the announcement, as you note, Deputy Mayor Malik, came after the establishment of the strategy. And there's no question that the announcement has had impact on us as an organization, particularly given that we do provide a supervised consumption service ourselves, and as well, given that we understand what the nature of the evidence is in respect of what's needed to address the drug toxicity epidemic that we face and that many other jurisdictions face. I think at this point in time, we're speaking to other partners, certainly with our community partners as well, to try to understand what the anticipated impact is. We know that there will be challenges, no question. We know that supervised consumption services, whether they come in that form or in the form of consumption and treatment services, have made a difference. You heard my colleagues speak to the numbers of client visits, speak to the number of overdoses reversed, and speak to the nature of services and connections that are made at those sites, given that they are important pathways and connections to a wide range of services. So we know that there will be negative impacts to health, no question, certainly to those in our community who use drugs. But I would argue when we look at health, when any of us in our city is doing less well, we all do worse overall from a health perspective.
Thank you very much. And to that point, I mean, just here today, but we've been hearing about it since for a long time, and especially as these changes were announced from experts, health experts, and folks who have expertise in the well-being of Torontonians and delivery of services in, neighborhood cohesion. We've heard from folks here today really powerfully who have lived and living experience, who work with people who have been accessing supports around mental health and substance use and harm reduction and treatment. And what data and expert analysis are we seeing and are we marshaling when it comes to the impacts of these changes? And if you can speak to or summarize the steps that we're taking as a city to make sure that we are gathering that information from our emergency services, from the divisions and agencies that we know will feel the ripple effects of this, and proactive step, as proactive as you can be in response to these announcements that we are taking as a board and as a city.
So through the chair, with respect to the announcement and what we have specifically had to do on our services, we certainly had to provide, as did other services that are impacted by this policy change, a report to the province and an assessment around what we anticipate will be the challenges and how we will try to support as much as possible clients who are no longer able to access a service after March 31st. We have also, as you know, Deputy Mayor Malik, through the Our Health, Our City implementation panel, started conversation with a wide range of partners, some of whom are city partners and some of whom are more community partners, to have the conversation around what is the anticipated impact of these policy changes. What might we expect to see in respect of first responder calls when, in fact, there are no longer services available? Whether they're supervised consumption services or consumption and treatment services. What might we anticipate by way of public drug use? What might we anticipate by way of calls to the various first response agencies, whether we're talking about paramedics, fire, police, or the Toronto Community Crisis Service? I think they can all anticipate seeing more volume of service, more calls, and the overdoses that would have been reversed within the context of these services now presumably will be happening in places outside, no longer in the presence of trained professional staff who are equipped and ready to manage, challenging circumstances, and as well to actually provide contacts and referrals to important and necessary services. Everything from treatment to housing connections, to social support connections. These are the kinds of services that will no longer be available or will be less readily available given the loss of these important services.
Yeah, thank you. Go ahead, Councillor Perks.
During Colin's remarks, he made a point that prior to the opening of safe consumption services, the number of deaths from overdose per 100,000 was 7 something, and after we opened them, it was 2 something. Do you have more information about that, more specific information?
So through the chair, I'm going to refer to our staff to see if they have the specific information. We do know, though, through research, that as the supervised consumption services were established around the city, we did see an almost 70% reduction in overdose-related deaths within a 1 kilometer radius of each of those sites. So I'm happy to get you the rates as they were before and what they were after the implementation of supervised consumption services and or CTSs. But we do know that for each of the services that are available, that we have seen a significant reduction, up to almost 70% reduction in overdose deaths.
So there's a quantifiable number of people whose lives have been saved by these services.
Through the chair, absolutely.
That might be helpful to know more about. Thank you.
Councillor Thompson?
Yes, thank you very much, Mr. Chair. Through you, with respect to the cost of ensuring that these facilities are in place, what is that number?
So through the chair, I can't speak to the exact cost of the other services or the funding that goes to the services other than the one that we run. But our service is a little over $1.5 million.
Right, so have we done no modeling, though, in terms of replacing those particular services that would be obviously canceled as of the 31st?
Sorry, through the chair, modeling in respect of? Looking
at city providing the sort of being able to pick up the loss, replacement of the services that the province is going to eliminate, because I assume that they're going to continue with respect to their decision. And so somewhere, somehow, we have to pick up the slack. So I'm just wondering, what have we done in terms of looking at that as an option? Because this is a service that is needed. Obviously, we've heard from the speakers, but also we know that this has been going for many years. You and I have been at this for 15 years? Or even longer, quite frankly, right? And so we are aware. So I'm just wondering, what are we doing in order to sort of pick up the slack that we know will eventually come about?
So through the chair, very briefly, this board did put forward a motion when we discussed the budget. And we know that we do have a city budget discussion and deliberation that's upcoming in the next several weeks and months ahead. So certainly that was a motion that was put forward from the board to at least explore the possibility of funding for the service such as it exists now, looking specifically at the service that's operated by Toronto Public Health.
Right. So there are two tranches, what we could potentially do to pick up the slack, and the fact that the provincial government has made their statement in terms of termination of their funding as of the 31st.
So through the chair, what I think I can say with respect to the other services is that we have put together a fact sheet that actually speaks to the client visits and the impact that that has been provided, like what is actually being addressed by the other supervised consumption services and consumption and treatment services. So when you take that together, assuming that their funding would continue, presumably they would see at least that level of volume of clients. And again, depending on how much funding is provided, I would imagine that the service provision and the number of clients seen by each of those services would adjust relative to the funding and, of course, the hours of provision of service. We know that that's certainly one component.
Certainly. Thank you very much for that. To Ms. Angier Campbell, through you, Mr. Chair, on the TCCS, the program is going quite well. It's been expanded across the city. You've accelerated the timelines and so on, and congratulations, that's absolutely fantastic. What I wanted to understand, though, in terms of notification, in terms of broadly providing communications to the general public, how is that being done? I mean, we've sent some information out through our newsletters, for example, but still we find that a lot of people still don't know that the service exists.
Thank you for your question, Councillor Thompson. So certainly we have, so historically we were doing public education through bus shelters, TTC, buses, etc., social media, in the 60% of the city where the service was operational. We took a cautious approach because we didn't want, for the areas of the city where the service was not operational until this summer, for people to start to depend on it and then not have it available. However, this fall, September, we launched our first citywide public education campaign. And so that has included similarly social media ads in bus shelters using the TTC system, et cetera. We are now benefiting from the campaign that is on getting Torontonians to make the right call and distinguish between 911, 211, and 311. And we will continue to do public education efforts. Our partners on the ground are also, when they're not responding to calls, they're also door knocking, going to festivals, et cetera, so that we can build community awareness. It's going to be an uphill battle, I would say, to keep doing and reinforcing for every Torontonian that this service is available for their families, themselves, or someone that they see, a neighbor on the street. And so we will keep doing public education in order for people to know they can call 211 as the primary way to access the service.
Thank you. Thank you, Mr. Chair.
Okay, thanks. Any further questions? Deputy Mayor Morley, go ahead, 5 minutes.
Thank you, Mr. Chair. Just a quick one for Dr. de Villa around the proposal of heart hubs. I think it might be helpful for members of the public and those of us concerned about the go forward from the province to understand a little bit more about what's being proposed with respect to the heart hubs, what services they will be providing, how that will or will not integrate with work we are doing, and what gaps we anticipate they may leave.
So through the chair, Deputy Mayor Morley, thank you very much for the question. At a very high level, as was presented, earlier this morning, this is the new policy direction as set out by the province, and the notion is to provide funding more directed towards treatment. We heard a number of our presenters speak specifically to the underlying rationale behind this change in the policy direction. So with that, there's no question. I think when we look, and as you've heard us speak many times at this table over the many years, there is certainly a role for treatment. There's no question. But we all understand, and when we look at the evidence that's out there in respect of how best to support people through to the best health and to reduce inequities in existing health status when it comes to issues related to substance use, what's needed is a fulsome, comprehensive suite of options available. Certainly from a public health perspective, prevention is one of them. We've heard a lot about harm reduction. Harm reduction is, of course, another core component to that. And yes, treatment is part of that as well. You've also heard some of the deputants here today, and you will have seen in our own reporting over the years that policy initiatives, creating an environment that actually supports better health and reduces inequities in health status, it certainly applies across the realm of health issues, and absolutely it applies here in respect of substance use. So these are the kinds of things that we will promote. So again, because they're informed by the evidence. So there's no question, there is a role for treatment. And there is no question, we have seen in our community that there is need for greater investment in treatment options available. Optimally, we should be looking at making sure that the broad range of treatment options that meet the needs of several different members of our community are actually available, and they should be supported as well by prevention efforts, by harm reduction efforts, and a policy environment that actually supports and promotes better health for everybody.
Okay, thank you. I do have one question. So Director Ozode mentioned the TCCS program, and then you mentioned that there's a 25-minute to get to a client. Can you perhaps inform the board of the council decision this past week around using the King Street corridor?
Happy to update the board through Chair. This week at Council, through a motion moved by you, Chair, the Toronto Community Crisis Service was added to the exemption vehicles on the King Street route, so they will be able to go on that route to be able to reach clients in a faster way. And I think this will help improve overall response times. I think it's also important for us to reiterate that it isn't an emergency response. This service is intended to meet people and provide supports who are going through a crisis. But I think part of what we will monitor over time is our overall response times to make sure they are within a reasonable range. And right now they are within that range of 25 to 30 minutes.
And thank you. And Dr. de Villa, perhaps you could let the team know any surprises based on this report? I mean, it was comprehensive, but is there anything that's in there that you found surprising and maybe we should pay attention to, perhaps?
Sorry, in respect of the
progress report itself.
Well, actually, thank you, Chair. That's a great question. I'm actually impressed at how much progress has been made in a relatively short period of time. I'm not telling you that we have solved all the problems by any stretch of the imagination, but these are really heavy lifts that are called for under the terms of this strategy. And these are complex issues that we're dealing with lots of opinions, as you can see around the room. So perhaps I wouldn't characterize it as surprise, but I might characterize it as, I do feel a real sense of gratitude to our partners, to our staff, and to all those engaged in this work. It's a very heavy lift. But I am heartened by the commitment and the passion that people bring to this important work.
Thank you. Seeing no other speakers, questions? Speakers, Councillor Perks.
Thank you, Mr. Chair. To begin with, I want to move a motion that the Board of Health requests the Medical Officer of Health in consultation with the City Solicitor to provide a summary for the January 2025 meeting of the Board of Health of any legal issues related to the provincial decision to close safe consumption facilities in Toronto. And 2, request the Medical Officer of Health in consultation with the Chief of Police, the Toronto Police Service, the Fire Chief and General Manager, Fire Services, and the Chief Toronto Paramedic Services to provide a summary for the January 2025 meeting of the Board of Health of likely service impacts related to the provincial decision to close safe consumption facilities in Toronto. So I'll talk to each of these and some additional comments. First, it is worth remembering that the Supreme Court of Canada ruled, I think about 10 years ago, when the federal government attempted to close safe consumption services in British Columbia, that it would be a violation of the rights to equal access to health services to close safe consumption sites in British Columbia, that governments are not allowed to arbitrarily remove health services from a particular group, which is exactly what Premier Ford is doing here. He may not have described it that way, but that is the point. So I think getting a little bit of advice, it may have to be in camera, I don't know, but getting a little bit of advice about that might be helpful. As to the others, members of the Board of Health might not know this, but over the last couple of years, the City of Toronto has been struggling with response times to 911 calls. We actually had work done by the city's Auditor General showing that there were real problems. And there are many different factors that played into that. One of them was the entanglement of all emergency services when an overdose call came. All services responded. So there's been an effort to try to have that be a health response rather than a police response or a fire response. That disentanglement has started to show some improvement in the response times of fire and police. That will be completely wiped out, and we will be in a worse position if the thousands of overdoses that are reversed every year at safe consumption sites suddenly become the responsibility of our first responders. Now, it shouldn't have to matter. It should be sufficient just to say that people who use drugs are at risk of dying. That should be sufficient, but it isn't. We have to explain to people how this impacts everyone's health and access to emergency services. The final thing I wanted to talk about, and it's not part of my motion, is this idea that the heart services are somehow a replacement for safe consumption services. As Dr. de Villa's predecessor said when we were considering creating these services, he hoped that if he had a family member or a loved one who used drugs, that they would seek treatment. But more importantly, he would hope they stayed alive long enough to get to that treatment. It's awful to say, but you can't treat someone who's dead. The fact of the matter is that for each person, there will be a time when they're ready to seek treatment. And you have to have those services ready for when they're ready to seek treatment. And we don't in Ontario, that's clear. But to say that we're not going to help them stay alive until they reach that decision is, as members of the public said, murder. It's as simple as that. So, as we've heard you, we're going to keep fighting. The recommendations already in the report say that we should continue to fight. I wanted to add a little bit more so that we can reconvene in January, perhaps with some advice from some of the city departments that are going to be dealing with this to continue our fight. This is a fight we must win.
Thank you, Councillor Perks. Any other speakers on the item? Deputy Mayor Malik.
Thank you very much, and thank you to Councillor Perks for bringing forward that motion, and it deserves our support. As was mentioned earlier this month, we had the first meeting of the new Our City, Our Health implementation panel, and as the Medical Officer of Health described the composition of the panel, and what I can share with you from the degree of discussion and the level of expertise and care around the table is that that implementation panel is a group of dedicated, caring, and expert individuals who are working to make a difference in the lives of people who are impacted and connected to mental health, substance use, harm reduction, and treatment in our city. And the depth of knowledge and experience at that table is astounding, and we are well served in the city and in this strategy by their engagement and their expertise and the willingness to be in this work alongside us as we grapple with some of the most challenging and the most important issues, not just for our time in our city right now, but for our future and what the legacy of our work is as we move forward. And following the recommendations before us, the panel is already preparing to prioritize the next steps necessary to implement the Our Health, Our City recommendations and to take the concrete steps forward and to take that role around implementation and guidance very seriously. And when finalizing this report and appointing the panel, the latest actions by the provincial government to the sector were not known, and that has been such an important piece of our discussion here today. And that's why this annual report and this strategy as a whole is so important. It's important because we need to continue to protect services Toronto residents rely on for the well-being of our neighborhoods and of individuals, and for the work that we have to continue to do together to build safer communities and to ensure that supports are available now more than ever, and especially as other levels of government take away and pull back on those life-saving supports. And through expanding our crisis supports and strengthening community partnerships and prioritizing Indigenous wellness, important work has been done, and we still have so much more work to do ahead of us, and we are not alone in those efforts. And this strategy keeps us and our partners on track, and it makes sure that we are on track regardless of what the circumstances are. And that is so important and so critical. And as we move forward in approving this latest update and in strengthening our continued efforts, I do want to recognize the important leadership of course, our medical officer of health as she wraps up her time in the role, and particularly to recognize the work of Upala, who I've had the honor of being able to work alongside since the very start of my term, and in this effort around the development of this strategy and also the implementation panel. And to thank her for her commitment and her care, and in that dedicated effort that wherever you are, our shared alignment around making Toronto a safer, healthier, and more equitable place is unwavering. And to thank you in all your efforts that have brought us to this point, and to wish you well as you take this next step in your incredible efforts, and to know that our work together is not over. It just will take a different shape. Thank you very much.
Thank you. Anyone else speak? Okay, I'll speak then. I do have a motion. Let's pull it up. One of the deputants mentioned this. It's around the national framework on advertising for sports betting and supporting Bill S-269. And forwarding a letter to the Minister for Mental Health and Addictions to express our support on this item. Just want to go back to our health, our city, and the progress report. Just want to thank staff. A lot of work has gone into this. As you can see, even the presentation took a long time, but the work itself is just so encompassing. And many city departments have been involved in this to support those who are most marginalized in our city and in our community. And of course, we must always support those who are most marginalized in our city because they need the support. I've been very vocal from the very outset about the closure of safe consumption sites. I have done the media circuit. I've gone to various SCS across the city, supporting the staff, the frontline staff, talking to the clients who are in the centers, showing my support to them. And I will continue to do that. This is a form of downloading of healthcare services. That's what it is. And I know that it's kind of sugar-coated around the heart hubs, and even that is underfunded as well before it even comes to the table. And we need to also see that as well. We need to make sure that the province is a partner with the city, and they have not been. And so I know myself and everyone around this table and council and the mayor will continue to advocate for people because people's lives depend on our advocacy. And everyone needs to be seen and heard, as many of the deputants have mentioned. So we will continue to hold your feet to the fire until this horrible initiative is reversed. And based on what I've been hearing, I have to say, from various nonprofit and healthcare agencies, everyone's been on the same page on this one issue. And I feel that based on what I'm seeing so far, I am hopeful that they will change their minds. Maybe I'm being too optimistic here, but I believe in my heart that they will have a reverse course on this. So thank you to all those who deputed today. Thank you for all that you do for our community, and we have your backs. Thank you.
Don't forget to like, comment, share, and subscribe to our YouTube channel. And please follow our social media platforms. And for more information, please visit our website.